Hello, my name is Emily Roeder, and this is my pharmacology video presentation. Fair warning, some of the medications are a little bit difficult to pronounce, so if I don't pronounce a medication correctly, please forgive me. But anyway, let's get started. So, for anxiety disorders, the primary medications that are utilized to treat these disorders are SSRIs. So, the generic name of the SSRI is sertraline, a very common one that is utilized to treat anxiety disorder, and the brand name of that of sertraline is Zoloft. Same with the SNRI. The generic name is venlafaxine, and then the brand name would be Fexer. So, secondary medications that are utilized to treat anxiety disorders are benzodiazepines or diazepines. I've heard them pronounced different ways, but a lot of people call them benzos. So, example, the generic name would be lorazepam, while the brand name would be Ativan. It's very important that these are used for short term only because they are very addictive. They have very addictive properties within them. So, finally, buse but this one's a little bit trickier. Buspirone and or otherwise known as Buspar. I was not quite sure on how to pronounce that one. I worked with Google Translate to try and get that, but I just couldn't do it. But anyway, so those are also beta blockers, and all those are used for performance anxiety. So, aside from the medication, alternative intervention for anxiety disorders are CBT. Cognitive behavioral therapy it has strong evidence base and it has long-term effectiveness. So, when it comes to bipolar and mood disorders, some mood stabilizers like lithium, there wasn't a brand name for lithium, but a generic name for another mood stabilizer is valproate. And then the brand name for that would be Depakote or Depakon. Secondary medications would be atypical antipsychotics. So a generic name would be Fluoxetine, another one I struggle to pronounce, or Seroquel. Um, and then finally, antidepressants with a mood stabilizer would prevent mania when working together. Um, Another alternative intervention, CBT once again, helps manage depressive symptoms, reduce relapse, and promote medication adherence. Personality disorders, so primary medications, kind of like the anxiety medications, SSRIs, so generic name Flexitine, and then brand name Prozac, and this particularly used for treating BPD or borderline personality disorder. Secondary medications are that are utilized are mood stabilizers. For example, lamotrigine or Lamictal. Um, Lamictal is the brand name. And that mood stabilizer is primarily used for impulsivity. Finally, antipsychotics, for example, aripiprazole or Abilify for cognitive symptoms. And then an alternative intervention for personality disorders is DBT. It's evidence-based for borderline personality disorder. So, schizophrenia, spectrum disorders, I find these very interesting because when I worked for a suicide prevention clinic, a lot of my clients were SMI, and so a lot of them had schizophrenia. And so, a lot of the medications that are utilized to help schizophrenia, I'm kind of familiar with just from working in the clinic. So, it was very interesting to do a little bit of research on them. So, some primary medications that are used to treat schizophrenia spectrum disorders are atypical antipsychotics, so risperidone, also known as Risperdal. Typical antipsychotics, so haloperidol or Haldol, and then long-acting injectable antipsychotics. I didn't know that was a thing, but it's very popular at SMI clinics. Um, Another intervention would be cognitive remediation therapy or CRT, and it targets cognitive deficits. Trauma and adjustment disorders, so primary medications, once again, SSRI, so you got that sertraline, otherwise known as Zoloft, which has been approved for PTSD. You have prazosin or minipress for nightmares and sleep disturbances, and anticonvulsants or atypical antipsychotics off-label. Some alternative interventions would be EMDR, which is validated by the APA for PTSD. So when it comes to the social workers' ethical responsibilities to the broader society, within social welfare, social workers have the responsibility to promote general welfare and empower marginalized groups. When it comes to public participation, social workers need to support public engagement and equitable policy reform. Public emergencies advocate for vulnerable populations in crisis. And when it comes to that, social or political action, address structural injustice, including pill mills and the unethical prescribing practices, over medication and the lack of access to therapy, big pharma lobbying and policy influence, and mental health stigma within policymaking. So there are some medication limitations for bipolar disorder. For example, mood stabilizers often require blood monitoring and have narrow therapeutic ranges. There are risks of side effects such as weight gain, sedation, cognitive dulling, compliance issues due to the side effects of the medication as well as the stigma that is held. And the medications alone do not address behavioral triggers or emotional regulation. That's where like those other alternatives come into play. So some alternative treatment for bipolar disorder intervention, psychoeducation and family-focused therapy. It empowers clients and families with knowledge of symptoms, triggers, and relapse prevention. Empowers treatment and adherence and reduces relapse rates and enhances communications and problem solving in families. Studies show that family-focused therapy combined with medication reduces reoccurrence more than medication alone. Those are my references. So thank you so much for watching. Have a good day.